Good afternoon, everyone. Welcome to our Erie County COVID-19 update for December 10th. Glad to be here today. We'll be hearing also from Dr. Gail Burstein as well. We are pleased, as always, to have Karen Gambino from Deaf Access Services providing the American Sign Language for you today. We'll get right into it. As of December 8th, there were 30,704 unique COVID-19 cases across the county, from the first case to the most recent case. Our 7-day positivity rate is now 6.9%. We've had a couple days where numbers are pretty good, but was also hearing from epidemiological staff today that the numbers are a little higher for today, which we'll be releasing soon. They don't have it all completely cleaned up yet. Unfortunately, I have to announce that there are 23 new deaths that have been confirmed as a result of COVID-19 by our epidemiological team. And the total deceased since the beginning of the COVID-19 outbreak is now 925. We did not include the deaths from yesterday, though you may have heard that more than 3,000 individuals died yesterday as a result of COVID-19. That is more than the amount of individuals who died on September 11th, and it's one of the worst days of death in the history of the United States. So we certainly are very, very concerned about what's been happening, and we want everyone to understand that we offer our deepest condolences to the loved ones and the families of the unfortunate people who passed. We seem to be having a little lighting issue here, kind of changing on its own. Might need to adjust that, Dan, if you could. It's flickering, going up and down. It's pretty bright right now. It's this light, not that. Oh, it's that light. Let's try one of those. So, yeah, I want to just do that. That's fine. Having a little issue. Technical issues always happen, especially when you do things on the fly. But once again, I was noting that we've had 23 new deaths in Erie County since December 4th through December 8th, and the total is now 925. And unfortunately, I do know some individuals who lost recently loved ones, and I do offer my deepest condolences to those who have lost loved ones. Hospitalizations as of November 8th, 517 individuals were hospitalized across Erie County that were COVID-19 positive. 110 of them were in the ICU. 436 patients were in Erie County hospitals, of which 88 were in the ICU. 62 were on an airway assist. Unfortunately, 4 people died on December 8th in the hospital, and there were 33% of the patients that were aged 64 and under. Just to show you, we've broken down the new COVID cases by zip code for the positivity and in the week ending December 5th. So this is positivity rates based on as compared to also raw cases. The town of Boston had the highest amount. 15% of the tests that were performed on town of Boston residents for the week ending December 5th came back positive. Derby was second, Derby in the town of Evans. Then Glenwood, the area where Kissing Bridges and Spragbrook Park is. Akron, North Collins, Clarence, Gowanda, East Concord. So some of these are very rural communities, and they're coming back with some of the highest rates of positivity for the tests that were administered. And then we previously had talked about the towns with the highest raw new cases: West Seneca, Hamburg, Lancaster, which is the same exact 3 that it was the week before. But we've seen some really, really high numbers in some of these rural and suburban communities. We're actually doing better in more of the urban settings or the inner ring suburbs. They seem to be doing better than we were earlier in the year. So we're really seeing some extremely high numbers in the rural communities, as well as some of the suburbs or exurbs, so to speak. And we just want to remind everybody that COVID is everywhere, and it seems to be spreading much more rapidly in the areas of where there's less population in Erie County. So it's not density of population that's causing the spread. We believe it's individuals just not paying attention and taking into account the mask wearing rules when they're not around people they haven't been around. If you're around your immediate family, you're probably okay, but we know there's immediate family spread that exists. But if you're going to a friend's house to watch a football game, have dinner, there's a good chance you're going to catch it because it's everywhere. The Erie County COVID hospitalizations since March 2020, these are the numbers you see. with the ICU numbers on the bottom as well as hospitalizations. Once again, thankfully, ICU numbers are lower than the numbers associated with the pure hospitalizations. But on December 8th, I can confirm that basically 84% of all beds, hospital beds in Erie County, were occupied, and approximately 50% of ICU beds were available. So we are getting to a point now where we're very concerned. 463 patients were reported on December 8th. It should be 400, I read that wrong. 436 patients were reported on December 8th. Sorry, I don't have my glasses on. It's the highest reported total in Erie County this year. 20% of those hospitalized patients are in the ICU. Dr. Burstein and I were on a phone call yesterday with the hospital CEOs. And they are concerned about the growth that we continue to see in the hospitals. They are doing what they can to increase staff capacity as well as bed capacity, but there will be a point, if we cannot stem the tide, in which we will see our hospitalization numbers get to the point where we are fully hospitalized. These are not all COVID patients. Remember, if somebody gets in an auto accident, if somebody's got cancer treatment, they are in a hospital. If somebody's getting emergency surgery for a heart attack or something, they're in a hospital. So these are not all COVID patients when we talk about the 16% of beds being available. But the 436 patients on that day were individuals who had COVID-19. So we want people to understand that our full hospital capacity is getting closer than it was in the past, and as a result, we are concerned about that. During the hospital call yesterday, I asked if there were individuals that they were able to track who they believe caught COVID-19 because of a Thanksgiving dinner, and one of the hospital systems identified that there were 6 individuals who actually appeared at the hospital that attended the same hospital or Thanksgiving dinner. 2 of them were admitted, the other 4 were thankfully being able to send home. Their symptoms were not severe enough to be hospitalized. But that's one family, it appears, where 6 individuals got so sick that they were able to identify that they went to the hospital. 2 of them were admitted, 4 were sent home for treatment at home. But it just goes to show it is spreading. It's spreading among family groups. It's spreading among people who've gathered. Let's hope that we can stem the tide, because we do not want to get to a situation where we're running out of hospital beds. Some interesting data we talked about last week on race and ethnicity and how this seemed to be affecting more whites, the second wave, and we've got more proof of that. With regards to deaths, the total of fatalities for whites is at one of the highest numbers. Actually, I think it is the highest number it's been since the beginning. 82.4% of all fatalities are whites, and African Americans are at the lowest number they've been, I think, ever since we started keeping this data, and it's basically identical to what the percentage of Erie County's population African Americans make. And it just goes to show that this is affecting rural areas, it's affecting suburban, it's not as affecting as much the city. So I want people to understand, if you live in Colvin, where Glenwood is, if you live in Derby in the town of Evans, if you live in some of the other communities we showed, town of Boston, just because you may be separated and you don't live in a very close complex or something like that you often see a subdivision in the suburbs, doesn't mean you can't catch it. And people are catching it, and people are getting sick, and people are dying from all across the county. And we're seeing more deaths of whites lately than we did early on. And it just goes to show that the second wave is definitely hitting with a vengeance, and it seems to be hitting with a vengeance in more rural and suburban parts of our county than the urban parts. And I also want to note, I want to thank the partners with the Health Equity Task Force that we've been working with for months now, who've really done a tremendous job, incredible job of getting information out, of helping people, those who they can identify that may be COVID-19 positive, so we get them tested right away, we get them the treatment. They've made a tremendous effort, and I want to thank the Health Equity Task Force for all the work that they've done. Residents once ago showing the City of Buffalo number of fatalities is less than the actual population percentage that the City of Buffalo has in Erie County. More people dying in the rest of Erie County as a percentage of the population than the City of Buffalo. It's just more evidence of what we've been saying lately, that this second wave is not only here with a vengeance, but is hitting the areas that were not hit early on. With that, I'll turn it over to Dr. Burstein to talk or little, whatever she wants to, with regards to the Western New York COVID-19 Analytics Work Group and their update as of December 8th. Got some new data, which has been shared with the hospital systems and others who need to know, but we want everyone to know it. So, Dr. Burstein.
Thank you. Thank you. Good afternoon. So I'm going to share some data that Dr. Peter Winkelstein from the Jacobs School of Medicine is sharing with us, just so we all know what to expect and what we can. The good news is there is something that we can possibly do to help bring these admissions down. Not necessarily without having to change anything up with the businesses that are being able to remain open. So this slide is looking at the COVID hospital census, and from the middle of October 15th, in blue, along with the COVID census in the ICU in orange, and the COVID census who are people who are on some type of airway assist or ventilators in gray. And so you can see very clearly that we've all been looking at for the past few weeks that our hospital census has increased, lagging behind a couple weeks where our total number of reported cases have increased. And this graph shows that very clearly. You can see in the yellow line is the 7-day positivity rate of COVID-19 in Erie County, and the red line is the total positive COVID-19 hospital census in Erie County, starting from July 1st and going till this past week. And so you can see that the number of the COVID cases in Erie County have risen about a couple weeks before the hospital census have started to rise. And so they've been rising together, and in the past week or so, they've been leveling off a little bit. So that is good news. And so if we take a closer look, this is looking at the hospital census from COVID-19 in the blue dots, along with what Dr. Winkelstein models projects for the hospital census in the yellow line, starting from October 4th. And the vertical line that I want to call your attention to is when the date on November 20th, which I'm sure we all remember, is when the date where Erie County, much of Erie County went into the orange zone. So you can see, interestingly, what it looks like now that we have more data and it's more time since we went into the orange zone, that it looks like there was some effect from the orange zone. You can see that the curve, although it's still increasing, it seems like it's flattening out a bit. It's not as high. The curve is not as steep as it was before we all went into the orange zone. So we can say, thank you, Governor Cuomo. We have seen some small effect with hospital admissions. The rate of rise is not as fast as it has been before the orange zone. However, this graph is showing what would happen if we all voluntarily changed our behavior to shut more businesses down, if we can just wear more face masks, do a better job on physical distancing, social distancing, and that is especially limiting our visiting to our friends and having friends over, going over their other friends' houses just to hang out or to have a meal. If we can just limit that, we can have a huge effect on our hospital admissions, on our COVID numbers, and of course, what is most important, our COVID deaths, so save the precious lives in our community. So going to be talking about Erie County response, and I turned it over to the county executive to talking about back to business. I have to say that this week I spent all of my gift cards for Hanukkah.
I have to spend my gift cards, but we've had a lot of people buy gift cards. Actually, so much that our Shop a 716 gift card, buy one, get one free program is sold out. You can still buy gift cards through amherst.org/shop716, but we have sold out of all the buy one, get one free gift cards, where if you bought $25, you got free $25. But we want people to understand that the Shop 716 program is still in existence. You can buy the gift cards, you can give them to people for holiday presents, whether it's Hanukkah like our doctor did, or Christmas upcoming. Over 670 businesses are participating in the program. Merchants can still opt in if they want. And we've sold more than $1.2 million worth of cards. That's money that's going to go back into our local economy. You must use the free bonus gift card by December 30th. So you can go shop right now. You can buy the cards and give it to someone, or you can go use it to shop at one of our local establishments. We want people to continue to utilize the program. It's been a huge success. We know that more than $1 million is going to be pumped into our local small businesses. You can't use these gift cards at some of the big box retail national stores. You can only use them locally because we want the dollars going into our local economy, because money that's spent locally is earned locally. It goes back into the pockets of our local workforce, who then, of course, spend it themselves. And with that, I'm going to turn it over to Doctor. I guess we should have rearranged the order of this, but I'll turn it back to you to talk a little bit more about testing, including schools. We got some great new information on schools that are participating in our programs. So, Dr. Burst.
Thank you. So we're so excited that we're able to work with our local school districts and schools to help get them to open up their doors and let their students in for in-person learning. So so far, the Erie County Health Department has received 8 signed MOUs to use our limited service license from different school districts across the county, and then also 16 from various private and parochial schools. So we're really excited that we're able to help them out. So in the MOU, we spell out what the schools need to have in place to be able to operate their own safe and confidential testing program. Also, we spell out that the schools are going to be reporting their positive and negative test results to the New York State Health Department. And our Office of Epidemiology is our school team. We have a specific school team in our Epi office, is continuing to investigate cases among students and staff. And I have to tell you that staff-to-staff transmission in the schools is still an ongoing issue. We're not seeing, not seeing transmission from students to students or students to staff. However, we are seeing transmission from staff to staff. So that just is consistent with the science that we're seeing more adults being more efficient and transmitting COVID-19 than children. So this is a graph looking at the number of cases reported to the health department that were either students in the schools from pre-K to grade 12 or staff in those schools. So you can see that the numbers have been successively increasing. There was that week, that break where all schools went virtual, and you can see we saw a significant decline in the reported cases from those schools. However, we're back up again, and the last number, so far it's only Thursday, and I think these data were pulled yesterday. We already have half the week, 132 reported cases from schools so far. So we are seeing cases associated with schools. Fortunately, most of those have other sources of infection that, people are getting infected from others in their household or from their friends or family members, small gatherings, Thanksgiving. Unfortunately, however, there has been some limited transmission within the schools, primarily among the staff. So just, again, reminding folks that the Erie County Health Department is offering COVID-19 testing. We are testing residents that have COVID-like symptoms and residents who are identified as close contacts, so they should be in quarantine already, regardless if they have symptoms or not. So again, call 716-858-2929 to schedule. These are by appointment only, and they're free. The only thing you need to do to show up to get in a test is have an appointment. So please, we're getting a lot of no-shows, and we know that that many people in our community want testing right now for various reasons. So if you can't make it, please give us a call to cancel that appointment. And then there are things that we can do to bring our numbers down, to bring our hospital census down, to protect these precious lives in our community so we don't have these number of deaths from COVID-19. Just some really easy things to do that I hope all Erie County residents, it'll be like a light bulb that clicks that says, hey, today's the day I'm going to start. So just number one, really important, stay home when you feel ill. Our contact tracers have told me that when they were doing their contact tracing and figuring out when people have to be in isolation and quarantine and who they could have exposed, that people are coming to work, people are sending their kids to school, people are going over their friends' houses for social gathering when they're not feeling well. And you might think, oh, it's just a little cold, or oh, I get this every year, it's just like a little sniffles, or I get these headaches, sinus headaches every year. But if you get something that is unusual in your body that you don't normally have every single day, the only way you're going to know that it's not COVID-19 is by getting a test. And we have so many testing sites in our community. We have our COVID-19 testing site map that will tell you what tests are being done, the hours, if there's a fee. So please use that and get a test before you go outside with any type of symptoms. Even if your COVID test is negative, it could be a false negative, or it could be that you have another virus that's causing your symptoms. So please, if you're sick for any reason, please stay at home. Don't give anybody else what you may have. Also, avoid in-person gatherings, whether you're well or sick. You don't know if somebody else in the room could have an infection, or you could have an infection and not know and infect others. Please try not to travel. Don't travel outside of New York State. Even though we're upset with how high our numbers are, other states have even higher numbers. So please protect yourself and don't be exposed to these high numbers of COVID-19 in other states where they aren't practicing the same type of protective behaviors. If you do go out in public, please wear a face mask, and especially or if you for every reason you have to go over somebody's house, harm reduction, wear a mask when you're over there and never take it off, and try to stay on the other side of the room as much as possible. So physical distancing, we know, is still very, very important and important preventive measure. And of course, listen to your mother, wash your hands very well with soap and water. Remember the happy birthday rules, finish singing happy birthday before you're done. Remove your hands from the sink. So just want to talk about the stress level out there. I know that with everybody becoming ill with COVID-19 and the deaths that we're seeing, that we know that there are a lot of people out there who are having stress. So there are opportunities out there what people can do to reduce their stress. You can talk to somebody, and there are places that you can call for a support that are listed here on the slide. There is a hotline, a New York State COVID-19 emotional support hotline. There's crisis services. People are struggling with increasing, cravings with any type of substance use disorder. There's our Erie County Addictions Hotline, and then Spectrum Health. Other things that you can do is relaxation, meditation, breathing exercises. But again, do something. Stress is really tough, and it is manageable. And so just we have so much on our plate right now with the holidays and with COVID-19. So just do something, acknowledge your stress, and try to take action to reduce your stress. Talk to a friend, or call one of our numbers, or try some relaxation or breathing exercises. Those can really work. Again, I am really excited that CDC has a new director, Dr. Rochelle Widlinski, who is an infectious disease physician, and she also has specialized in HIV. So we're really excited that we have, a true public health physician that is on board and going to be taking over CDC. Just want to read off an interesting quote from her that is very true. So Dr. Widlinski says that if I have a cup of water, I can put out a stove fire, but I can't put out a forest fire, even if that water is 100% potent. So that's why everybody must wear a mask. And as a nation, we'll recover faster if you give the vaccine less work to do when it's ready. So we are excited that we're going to be getting COVID-19 vaccine in our community, we hope within this month. However, that's not enough. We can't just immunize our way out of this. We still have to practice our preventive behaviors, even when we have a vaccine on board. Number one, not everybody's going to be immunized at the same time, and we're not really sure how effective the vaccine will be to prevent transmission of infection to other people. So everybody has to get on board with continuing our preventive behaviors and continuing to wear our masks. And again, want to reach out and wish everybody who's celebrating Hanukkah a happy Hanukkah. The first light is tonight. I'm going to be celebrating with my family. We usually have a big family get-together with a pastrami sandwich. So instead, I am taking takeout orders for my family, and they can call me to tell me when they can drive over to collect their pastrami sandwich this weekend. So I'll turn it over to our county executive to answer questions.
Thank you, Dr. Burstein. I want to wish you and your family a happy Hanukkah, like to all those in the Jewish faith who may be celebrating on this first night of Hanukkah. And it brings up a point that the doctor's not going to say, but I'm going to. Unfortunately, I've seen some very serious anti-Semitic attacks against Dr. Burstein in social media lately, direct accusations against her and her religion. And then there's, of course, attacks on her integrity and what the work that she's doing from, unfortunately, other public officials. It is completely unacceptable and unconscionable. I actually had someone post on my Facebook page today that COVID-19 is a mongrelization and attempt to destroy the white Catholic race. Well, I'm Catholic. That is not the case. We need to realize that there is science, and science comes above all. But the nastiness, the racist, bigoted, anti-Semitic tones that I've been seeing from people in our own community is unacceptable. Dr. Burstein won't say it. I will. People have been comparing myself and the governor to Hitler. My God, folks, do you really understand the past? Heck, I'm Roman Catholic. My grandfather's cousin, Katarzyna Polańkarz, was killed in Auschwitz. She was a Polish freedom fighter. Just wasn't Jewish individuals that were killed by the Nazis, but the accusations that we're Hitler, that we're Nazis, because we're implementing protocols to create a safer society for all, is just ridiculous. But that's unfortunately what we've come to with many of the individuals, or some of the individuals in our community. And I'm going to call it out every time I see it. So to those who are fomenting hate, shame on you. The protocols that have been put in place are there to protect the public, to save lives. Nobody wants to do it. In just the last week alone, I've written many condolence cards to individuals I know who've lost loved ones. And I've got to write a few more because I know there's others who just lost them in the last couple of days. We are doing these actions to save lives, to protect as many people as possible. As noted yesterday, more than 3,000 people in the United States died of COVID-19. I don't know how many died in Erie County. We don't have that exact number yet. We'll be getting it very soon from New York State. We must do better. We can do better. And to those who want to create a racial divide, or for that matter, an ethnic divide, or religious divide, shame on you. That is not the American spirit. We are welcoming to all individuals, all races, all ethnicities. To my friends in the Jewish faith, happy Hanukkah. To those of us in the Christian faith who will soon be celebrating, of course, Christmas, but right now is in the season of Advent, Merry Christmas and happy holidays to you. But to those who want to divide us with hate, we will not be divided, and I will not let it happen on my watch. Open it up to questions. We'll start from the top. I think it's open. We'll start with WKBW. Olivia.
I'm actually going to jump in. Mark, it's Madison.
Oh, Madison.
Before Olivia. Olivia's on 2. She'll take round 2. Wanted to start with asking you about the COVID vaccine distribution team that came together earlier this week.
Mm-hmm.
Some doctors have reached out to us after the announcement, just kind of wondering why we have 2 businessmen leading this, and whether you're going to loop in any of the healthcare professionals, especially as Governor Cuomo has put an emphasis on getting that vaccine out to healthcare workers, and then especially the Black and brown community.
Well, first off, we have doctors associated with the Erie County Department of Health, as well as the medical facilities that are part of the team. What we wanted to do is bring in the individuals for logistics and operations, and these are individuals who are used to dealing with hundreds of thousands of dollars of goods coming in and out. And that's what we're talking about, is the operational aspect. The doctors are going to be involved, but the first batch is to be received this weekend. It's not coming to Erie County, to our knowledge. It's going to be coming to local hospital systems and will potentially be used by nursing homes. We know there's 4,500 nursing home patients in Erie County, give or take 100 on any one day. And we've been told that the first 17,000 batches will be coming. And those will be coming not to the county, we've been told. They're coming to an off-site location, we believe a local hospital. So we're going to be working with all partners, but when we talk about the logistical operation, there's not a single doctor in our community who's handled the hundreds of thousands of doses that are going to be administered, or for that matter, millions, because it's going to be roughly 2 million for just Erie County alone, when you talk about the double doses that are required. And I think that the doctors need to understand is right now it's going to be months, who may have criticized, it's going to be months away until the general public is going to be vaccinated. So right now we're putting together the team so that we can ensure that we can handle the doses when they arrive, that we have the distribution network so we can distribute them to the locations where the clinics are. And I heard recently from a doctor who was like, they want to be a site, they want to get going right away. There's no vaccine that's going to be available to the public for months in all likelihood. We've heard that from Dr. Fauci. We've heard that from New York State, Dr. Zucker. So I don't want people to think that if they go to their doctor's office next week or January 1st, they're going to be able to get the vaccine. It's just not the case.
And a quick follow-up, are you going to be releasing any sort of executive summary or plan for how it's going to be distributed in Erie County?
We will have an executive summary, but I want people to understand the vaccination plan is constantly evolving. It will change over time, but yeah, the executive summary is coming. The actual plan is in draft form, just being finalized right now, but it's always going to be in draft form. But I think people are looking to see, is it going to go to my particular doctor? Is it going to go to my neighborhood? That's not going to be in the plan. Right now, we have identified 3 strategic locations in Erie County to be mass vaccination sites, but we're also looking at smaller sites that are going to be available that we will be able to provide to the public. First is first. Nursing homes and our healthcare heroes are going to get it first. And it's probably going to go through the nursing homes and the hospitals. That's what we've been told, correct? And Dr. Burstein's saying yes. I don't even think Erie County is going to be involved in that aspect of it. And then it's going to be first responders, essential workers, and then the general members of the public. So it's going to be some time before the general public is actually going to have an opportunity to get the vaccination. And I'm not trying to downplay the question, Madison, it's a legitimate question, but I think there's some inaccurate information that's been spread by individuals who are trying to make it sound like vaccines are coming to our community and you're going to be able to get your vaccine next week. There's very few individuals who are going to be able to get vaccinated in the immediate future. And we are putting in place right now a plan to ensure that everyone who wants to get vaccinated will get vaccinated. Though, as a reminder, we cannot force anybody to get vaccinated. We need as many people to get vaccinated so we can develop the herd immunity necessary. Channel 4, WIVB, anyone on?
It's Marley Tosca. Yep.
Hi, Marley, go ahead.
My question is directed to Dr. Burstein. Dr. Burstein, we've gotten a couple complaints from people who have received a test, a diagnostic test from the county's health department, but it takes weeks, if anything. Some people tell us they never even heard back, that it's been 2+ weeks. They never got their results, and they had to turn elsewhere to get their test results.
Well, I'll answer. I'll just take that, Marley.
Sure.
We have a process in place that every test individual gets called within 24 hours of the Department of Health receiving the results. Now, I can tell you this because we're looking at it. We know of some places that are doing tests in our county that are not even reporting them to the state. But when it comes to Erie County, they get a call within 24 hours. And if they're at a rapid test clinic, which there are some with their Binax Now cards, they get their results immediately. So we had an issue in the past with contact tracing, and we did have a small issue where we had a very small percentage of the population that it appears for whatever reason they weren't called immediately. But we have put in process a place, and New York State is helping us right now, by providing additional nurses to make those calls so that every person, regardless of where they get their test from, when the results go in the state system and we receive it, get a call within 24 hours. Yeah, but as Dr. Bursing just reminded me, unfortunately, it appears not every place is reporting their data to the state system, which means we never get it. If it's a county, they're going to get it. I find it hard to believe after everything we put in place. If you want to share offline the information of the individuals, we'll be glad to look into it and see if they were actually tested by the county, but not online. We don't want to share individual health data. WGRZ Channel 2?
Hi, it's Kelly. I have a question that I don't know if you'll know the answer to, but the governor is scheduled to do his next press conference tomorrow. Earlier in the week, he alluded to the fact that there could be new restrictions coming for places that aren't in color zones or places that are yellow, specifically for a reduction in indoor dining. And I know that the hospitalization rates are what's really important right now as well in dictating what happens next. So based on the information you have right now, do you foresee any new announcements coming from the governor's office tomorrow?
I've not had any conversations in the last 48 hours with them. It would indicate that there is going to be with regards to Erie County. Remember, they are looking at hospitalization rates, as you know, and now we've had not a great hospitalization number for December 8th. Once we get the December 9th numbers from yesterday, it'll give us a better indication of what's going on. But I've not had any direct information. I do believe the governor may make some changes to with the determinations also in the orange and red zone as to what can open and what not. We've told that might be coming, but we'll just have to wait and see when the governor makes his announcement during his press conference tomorrow. Spectrum News, is anyone on? If not, the Buffalo News, Aaron Besker.
Hi, Mark. Sandy Tan. I'll take this question if you don't mind.
Sure.
Is there a good estimate that, or any better understanding that you have about how the state is going to make the determination about when a region is in danger of reaching that 90% threshold? We're already at 84%, and the state is looking 3 weeks out to see whether we might be crossing, the threshold to move into a red zone. Do you have any insight into how that's being calculated? Are you getting any ongoing feedback from the state regarding, if that might be imminent?
I would have to direct your question to the state. As I just said, I've not had any conversations with them in the last 48 hours in regards to it. And I think we're going to learn more when the governor makes his announcement tomorrow about any potential changes to the red and orange zone, at least what's allowed to be open or not. We've had some indication that that might happen tomorrow, but we'll just have to wait and see.
Okay. I just want to make sure there isn't some sort of formula out there about when you reach this point, we can assume that.
Sandy, you've asked the question, I think a lot in the last few weeks, and I just can't give you the answer. There is no red line rule. There's no black line rule.
Okay, thanks.
And you're better off directing the question to the state in that regard. Remember, it's also looking at Western New York data, and Western New York is not the same as Erie County, though they are putting the orange and red zone for Erie County. So I don't have the latest data to determine how many patients in Erie County hospitals are actually Erie County residents. There are probably some that are not. They may take that into account. I don't have that data, but it's available to the state. So we'll find out more tomorrow. WBFO, Ryan Zunner. Have any questions, Ryan?
No, I'm all set.
Okay. BEN, Mike Baggerman.
Hi, Mark. This question is actually for Dr. Burstein. Doctor, today the Buffalo Public Schools announced that, or rather yesterday they announced that they're going to be staying remote learning until February at the earliest. We know that there's a lot of schools locally that are going to be having kids in the classroom as early as next week. I just want to get your perspective as a pediatrician, just what you think about the decision for schools to bring kids in and what you think about Buffalo schools holding off until next year.
Well, first, your first question as a pediatrician, what do I think about schools inviting the students back for in-person learning? Well, the American Academy of Pediatrics published a statement a few months ago that stated that if it's safe, students should be encouraged to be able to attend in-person learning. And so we have months of data now showing that the schools are a safe place for students. We're not seeing student-to-student transmission. We're not really seeing a lot of transmission within the schools. If there is, it's been primarily isolated to staff. So we know that schools not only offer great educational opportunities, they also offers important social and emotional support for students. So I'm really excited that's why I'm really excited that we can help some school districts stay open by using our limited service license. So I think it's great that schools are able to bring students back, especially now. It's a very stressful time for everybody. So this will help give those kids that extra social emotional support that I'm sure they all need. We all need that. Just in terms of the Buffalo Public Schools, again, I'm really excited that they're seriously considering opening up in February. And, I'm not involved with logistics and plannings of what it would undertake to open up such a large school district. So all I can say is I'm excited that, they have a target when they can open up, and you'll have to ask them about, what the challenges that they foresee. However, I am really excited that we'll hopefully be able to work with them to help them keep their schools open. Thanks.
Is there anyone else on from B News or Western New York Media?
It's Olivia from Channel 7. I have two quick questions. The first one is for Dr. Burstein. We are kind of curious as to why the health department needs 120 days to respond to a FOIL request when the same information that's being requested is being brought up in press conferences and sent to the legislature. Why is it taking so long to get to the media?
I would recommend that you go through the FOIL officer with regards to that. I don't know if either of us probably even are aware of it. And she said they're working on responses, but she just said it's a lot more detailed than what we bring out here, and we recommend you go through the FOIL officer. There is a process and there's a mechanism, and so I would just recommend doing that.
Okay, and then my second question is, it's my understanding that the Health and Human Services Committee, the last time they met, which is, I guess, the legislature's way to find out information from the Department of Health on the COVID-19 outbreak, the last time they met was November 12th. This week's meeting was canceled, meaning they won't meet again until the new year, at a point when we're experiencing the highest rates of COVID here. Does that concern you at all? Should we be having these meetings?
You'd have to talk to the legislature. It's a different branch of government. There's two legislators who just were announced that have COVID, and actually I've communicated with both of them. I just want to wish the best to Legislator Ed Rath and Legislator Frank Todaro, who both tested positive for COVID. It was out in the newspaper. I'm not revealing anything that's not unknown. And when I talked or communicated with both of them, they both seem to be in good spirits and general good health, so I wish them well. But you have to talk to the legislature. I know that they're reducing the number of in-person meetings because of COVID, and it's up to the legislature to set its agenda. I am a separate branch of government through the administration, so it's up to them. WIVB, Channel 4. No other questions? WGRZ, Kelly Dudsig, do you have any more questions?
Yeah, I talked to Dr. Russo yesterday, and he told me that the full effects of any Thanksgiving surge could still be 5 to 7 days away, but he was pleasantly surprised about the numbers somewhat leveling off as far as positive cases so far. Does that give you hope that people will pay attention and be safe throughout the holiday season, through the end of the year, and until most of us can get vaccinated?
I hope so, Kelly. We certainly got a lot of reports of people just staying home on Thanksgiving and not doing the traditional family Thanksgiving. We did get reports, of course, and we've got some cases that we've proved of individuals who came together for Thanksgiving. I'm hopeful. It's certainly Thanksgiving is a one-day holiday that we all enjoy, but we also have some of the most important religious holidays coming up. and it's not necessarily going to be any easier for individuals to stay away from their family, whether it's Hanukkah or Christmas or during the Kwanzaa celebration and New Year's. I'm hopeful people will. All you got to do is look at what's happening around the rest of the country and see reports of hospitals that are completely full. A former reporter from the Buffalo area, Lou Raguse, who I'm still friends with, I was following one of his recent posts. He's in the Minneapolis area, and it was just horrible. The hospitals that are at their capacity in the Minneapolis area, which didn't get much in the first wave, and they're getting slammed now in Minnesota and in the Great Plains. And it's like that in a lot of parts of our country. So I'm hopeful that people are paying attention to what's going on and realizing, yeah, we want to be with our loved ones for the holidays, but I'd rather be with my loved ones for the holidays for the next 10 years and 20 and 30 years, depending on their age, than just this year and then have them potentially die. I know a number of people, friends of mine, who have their parents that are right now dealing with COVID-19. They posted on social media, including the publisher of Western New York Media, Mark Odian, who noted it, that his father's in a very difficult position in the hospital right now on a ventilator with COVID-19. And I know Mark wants to spend a lot of more holidays with his father, and I know we all want to be able to do that with our parents and our loved ones, so I'm hoping that people just understand that it's bad. It can get worse. We are worried, as Dr. Russo said, that there still may be a hospitalization spike, though we're very glad we didn't see a huge jump in our on the positivity rate across the board. That was at least a good sign. I think most people are paying attention, but it's going to be tough as we move forward through some of the best celebrations that any of us will do with our family on an annual basis. Buffalo News, I don't know if Erin's still there, or if Sandy, you got another question.
Yes, thank you. Two questions, actually. One is, I know that the state is getting feedback from county contact tracers about what they are seeing in terms of how the spread is occurring, and the governor has made mention that salons and gyms do not seem to be a big source of spread, and that there might, and I'm wondering if there might be some adjustments based on kind of the feedback he's getting from counties. And my other question, which is unrelated, is there any update on a percentage of folks who are dying of COVID-19 in the county who are living or contracting the virus from congregate living facilities like nursing homes?
I don't think I have the answer. We don't have the answer off the top of our head, but we'll get that for you, because we have been able to determine, at least most recently, how many people were in a congregate setting before they died. So we can get you that answer. And then with regards to the changes that may come tomorrow, we've heard that that's a possibility. We do know that it's generally been the small gatherings in enclosed spaces, personal homes, that were the problem. It's not to say we have never had an issue with a gym. It's not to say we've never had an issue with a salon, or we've had an issue with a restaurant. We have. It's just doesn't seem to be the driving factor. And that information has been shared with New York State. And it's possible the governor will make changes effective tomorrow. I know a lot of people would be very happy if he did, but that doesn't mean we need to let our guard down. Even if he did that, we still need to do what's best, because we're in this to protect each other. It's about saving other lives and doing what's necessary to protect other people. Nobody enjoys doing the protocols, so to speak, and the closures of salons, gyms, restaurants, and the information's been shared with New York State. And if New York State makes an adjustment, that's good. They made an adjustment on the schools. We talked to them behind the scenes for quite a long time, as we were one of the first ones to have the orange zone of how it was going to be impossible to reopen schools with the standard that they set, 100% testing on a weekly basis. They learned from it. They made changes, and now you're seeing the vast majority of schools are going to be able to open because they can meet the testing standards. So it's quite possible the governor will make changes tomorrow on what can be open or not. The biggest thing we want to do is to prevent the full pause, the full shutdown like we had earlier in the year. If our hospitals get full, we're going to get fully shut down, and none of us want to see that. Ryan, WBFO, any more questions? I know you didn't have one in the first round.
No, I'm good.
Okay, Michael Baggerman then, last question from WBEN.
Hey, Mark. Western New York's hospitalization number right now is 517, according to the state data. This is kind of a follow-up to Sandy's question from earlier. is Erie County looking at a ballpark number that says, okay, if we reach this number of coronavirus hospitalizations, that will get us to the 90% threshold? Is there a number that Erie County is working with?
It's interesting you say that, because that is a direct question that was asked of the hospital CEOs yesterday by me. And I want them to come up with that number. But it's not just COVID patients, it's overall patients. When we talk about 16.5% of beds being available, they're not all full with COVID patients. There are also patients who are in there for cancer treatment, for accidents, for surgeries, necessary surgeries, not an elective surgery. Someone's has a significant issue and they need to have heart surgery, they're going to have heart surgery. So it's a total patient count that is the key, because we do not want to be in a situation where we're overrun with COVID patients and then also cannot take care of the other things that necessarily happen in our community. And I'm waiting, I'm expecting in literally the next day a report from the hospital systems on what they think is the number that we will then let the state know. If we get that, we're in trouble. We're not there yet, but if we continue to see growth, we would be in a situation where we'd need to have surge capacity implemented, not just new beds, but more staff. And the state has committed to provide us more staff if need be, including for a facility that needs to be created to handle either subacute patients or, if, and hopefully never get to that point, a medical COVID-19 only facility. Okay, I think we've gone through everyone twice. Appreciate questions, they are important. Might not always be able to give you the answer that you're looking for, because I may not have the answer, but I do appreciate the questions from the media. Once again, to all of our friends in the Jewish faith who are celebrating the first night of Hanukkah, may you have a happy Hanukkah. And I know it is a very important season, of course, for the Christian faith, and I certainly wish everyone a wonderful holiday season. We're hanging in there. It's not great. It's not as bad as it could be, and we're hoping it never gets to that point. But we're hanging in there. We need to continue to avoid the mass gatherings. There's a lot of false information that is being put out on social media about some of the things that are going on in county government, or even myself. I just saw something silly saying I had a big Thanksgiving dinner at the Remington Tavern the day before Thanksgiving, which is false. It is ridiculous. It was nowhere the day before Thanksgiving or anywhere in that period, but that's the stuff you deal with when you're in the public sector. It's not always easy doing these jobs, but the most important thing is doing them on behalf of the greater community. We all know the folks that are working right now in public service, and especially those in public health, that this is the most important thing we will ever deal with in our careers. And when I look back on my career 20 years from now, 30 years from now, if lucky I'm still alive, I know we did good work in our community. I'm going to be able to look back and said, we saved lives. We worked with our partners like the Health Equity Task Force to address disparities that were occurring with regards to deaths and the issues associated with COVID-19 cases early on, and through our good work reduce that. We're able to work with our partners in the hospital systems to address the significant need that we needed to, not only now with regards to hospitalizations, but early on when the hospitals were some of the only ones that actually had testing materials. It's not been easy. It's not going to be easy for months still. It's still going to be a while that we're going to be dealing with this. But as I look back on my career, I know it's going to be a defining moment, and I know that the people of Erie County government, our civil servants, the ones that are working in our contact tracers, who are not leaving their desks so they can continue to talk to more people per day, the people in our call center who are receiving calls from people who are crying, who just lost a loved one, or they're fearful they're going to lose a loved one, and they're trying to find a way to communicate with them above and beyond the mechanisms that have been used. The people who answer those phones, the environmental health sanitarians who have to go out and enforce the rules and have been treated horribly by some individuals. Many people understand what's going on, and the vast majority of the people of our community are doing the right thing. Not everyone is. But I want to thank those professionals on the front line, our healthcare heroes and the testing clinics and the hospitals and the nursing homes, and the people that we have in county government that have been working pretty much nonstop for almost 9 months now. And we're going to continue to work nonstop for as long as it takes. And let's do our best to help them make their job as easy as possible by doing what we can to prevent the further spread of COVID-19, to reduce the numbers associated with the pandemic. We are all in this together. And if there's one thing the holiday season reminds us, is that we are all one big family. Regardless of whether you are a Muslim, a Jew, or a Christian, we are all the sons and daughters of Abraham. And we are all one big human family. Let us do our best to keep as many of our fellow brothers and sisters alive during this very difficult season till we can get them vaccinated, until we can protect them. And if we do that, we will all be better for it, and we'll all be able to celebrate future Thanksgivings, Hanukkahs, and Christmases together. Happy Hanukkah. Merry Christmas to all very soon. Be safe and well. Take care.